Hi everyone, welcome back to our channel. I'm Bonnie, and today we're diving into the concept of volume of distribution, or VD. This cornerstone concept is essential for understanding how drugs distribute within the body. Just like absorption, distribution plays a crucial role in a drug's journey, guiding its movement from the bloodstream to various bodily compartments. In this video, we'll introduce you to the concept of volume of distribution and its interpretation in pharmacokinetics. Let's get started. In pharmacokinetics, we think of the different tissue types as compartments that a drug can move between. In our earlier videos, we have focused on a one-compartment model for distribution, where a drug is injected IV and the plasma concentration increases accordingly with resultant therapeutic effects. The one-compartment model assumes that the body can be described as a single, uniform compartment and that drugs enter and then leave. However, in reality, when a drug is administered, the drug travels through the bloodstream and distributes throughout multiple body compartments. The rate and extent of distribution to different tissues and organs depends on several processes and properties, which will be discussed in our next video. In multi-compartment models, drug tissue concentration is assumed to be uniform within a given hypothetical compartment. For example, it may be assumed that the drug concentration is uniformly distributed through all muscle mass and connective tissue. Therefore, muscle mass and connective tissue may be lumped together as one hypothetical compartment. It is then assumed that the drug distributes between the central compartment and the hypothetical muscle and connective tissue compartment to maintain the equilibrium of the drug in these compartments. Multi-compartment models explain why plasma level time curves often exhibit a biphasic or triphasic drug concentration decline. The initial decline represents the drug leaving the plasma compartment, central compartment, and entering one or more tissue compartments as well as being eliminated. This phase is known as the distribution phase. The distribution phase is characterized by the rate constant alpha, or A. Once the distribution into tissues is complete, the plasma concentrations decline more gradually. This is known as the elimination phase. The elimination phase is characterized beta or B. Multi-compartment models have been used to explain and predict plasma and tissue concentrations for drugs with nonlinear plasma drug level time decline. One-compartment models are used when a drug appears to distribute into tissues instantaneously and uniformly, or when a drug does not extensively distribute into the extravascular tissue. For example, aminoglycosides are polar, charged moles with a distribution primarily limited to extracellular water. The plasma levels of aminoglycosides may, therefore, be described well by a one-compartment model. On the other hand, lipophilic drugs, such as benzodiazepines, distribute widely and rapidly into well-perfused tissues, but more slowly into tissues with low blood perfusion and different affinity for the drug. The plasma levels of these drugs are better described by a multi-compartment model. An understanding of compartment models to describe the distribution of drugs is important when reviewing plasma drug levels post-administration. For example, digoxin levels decline rapidly during the initial distribution phase, while the amount in the tissue compartment takes 3 to 4 hours to accumulate. Reviewing digoxin's blood concentration immediately after administration may overestimate the amount of digoxin distributed into the cardiac tissue. Consequently, it is recommended to take digoxin levels at least 6 hours after administration. VD is the ratio of the total mass of drug in the body and the concentration of drug that remains in the plasma. Let's review an example calculation. Suppose that a 1,000 mg dose of drug X was administered intravenously, resulting in a plasma concentration of 10 mg per liter. The apparent volume of distribution can then be calculated by dividing the dose of 1,000 mg by the concentration of 10 mg per liter. The resulting volume of distribution is 100 liters. An average 70-kilogram body contains approximately 40 liters of fluid. Therefore, a volume of 100 liters is well beyond our body's fluid volume. Volume of distribution is a theoretical term, that is why it is often called the apparent volume of distribution. It describes how readily a drug leaves the systemic circulation and transfers to cells and tissues. A small volume of distribution indicates that the drug remains in the plasma. An example is warfarin, which has a volume of distribution equivalent to 8 liters. A moderate volume of distribution indicates that a drug distributes mostly into extracellular fluid. An example is gentamicin, which has a volume of distribution of 20 liters. A large volume of distribution indicates that most of the drug moves out of the plasma and distributes into other tissues, such as fat, muscle, lung, spleen, thyroid, and skin. The large volume of distribution of some drugs explains some of the adverse effects seen with these drugs. For example, amiodarone has a volume of distribution of 110 to 900 liters. Amiodarone is known to cause skin pigmentation and pulmonary toxicity. Clinically, the volume of distribution can be used to determine the required dose of a drug by multiplying the desired plasma concentration by the apparent volume of distribution. For example, if we required an initial plasma concentration of 5 milligrams per liter and the volume of distribution was 400 liters, we would need an initial dose of 200 milligrams. Thanks for watching. If you found this video helpful, please give it a thumbs up and subscribe to our channel for more insights. In our next video, we'll be discussing another important topic in pharmacokinetics, so make sure to hit the notification bell to stay updated. Until then, take care and stay informed.